Thank you so much for joining me today. My name is Jocelyn Donovan. I am the CPNP for Niwasik and Daswin Tag. Today I'm going to talk to you about what you can expect from your prenatal appointments. Now, I'm filming this in the summer of 2021, which means that COVID is still a real issue and it is changing how some of your prenatal appointments will work. I'm hoping that going forward we can expect more typical prenatal appointments, but I'm going to try to give you information about both COVID protocols and your normal prenatal appointments. One of the first big decisions you have to make when you find out that you're pregnant is you have to decide if you would like a midwife or a doctor to be your primary healthcare practitioner during your pregnancy. In my first pregnancy, I used a midwife, and in my second, I used a doctor. I received essentially the same care, but there are some key differences. Since 1994, both doctors and midwives are covered by OHIP for any pregnant person seeking care. Both doctors and midwives can care for pregnant women, see clients for prenatal visits, order laboratory and ultrasound testing, arrange for consultations with other doctors, give some medication during pregnancy, birth, and postpartum, and monitor your newborn after birth. Midwives can also assist in home births and births in birthing centers. They can also come to your home postpartum to weigh the baby, examine him, and to give you care as well. You do not need a referral for a midwife. Once you know that you are pregnant, you just call them. So I had a really hard time getting a midwife the first time around. I was only 5 weeks pregnant and all of the midwives in Brantford and Hamilton were full. So I ended up getting a midwife in Cambridge, and it was a little annoying to drive for 40 minutes every time. So fingers crossed, if you want a midwife, you can find one here in town. I personally really appreciated having a midwife in my first pregnancy because they had a number that I could call at any time with questions or concerns. And in my first pregnancy, I had a lot of questions and concerns. I could also call them in the 6 weeks following the birth of my baby to ask them anything I wanted and to get help with breastfeeding. For my second pregnancy, I used an OB. I didn't have as many questions about my pregnancy, and since I had some medical problems in my first pregnancy, I decided to use a doctor. I did find that my doctor was able to make decisions a bit more quickly about my care. So for example, I was experiencing early labor in both of my pregnancies. I had early labor quite early on. And with my first pregnancy, the midwife was, very wait and see. We'll see what happens. I don't know. Let's wait a while before we book an induction date. And with my doctor, once I had the same symptoms, she was like, okay, yeah, 39 weeks, we'll get you an induction, no problem. So I personally really enjoyed having that kind of definitive answer right away, but it really is a personal choice, and they are both amazing, valid options who will help you stay safe during your pregnancy. Now, true or false? If I use a midwife, I can't use any pain medication during birth. False. Midwives can administer some pain medication during labor, but they cannot administer an epidural. If you do decide to get an epidural, you will be transferred to a doctor for the delivery, but your midwife will stay as a support for you, and you will be back in her care after the delivery. Typically, you will have prenatal appointments once a month for most of your pregnancy. That will increase to once every other week near the end, and then once a week at the very end for the last month or two of your pregnancy. In your first appointment, the doctor or midwife will ask you a lot of questions about your medical history, your family's history, and your current health. It is very important to be as honest as possible when answering these questions. This includes honesty about medication, drinking, smoking, drug use. Your healthcare provider is not there to judge, but they want you and your baby to be as healthy as possible. They will help you weigh your options and find what's best for your situation. In one of your early appointments, you will get requisition for blood work. I couldn't believe how much blood my doctor ordered for my first pregnancy. 14
14 vials of blood. I got checked for absolutely everything. While it is unpleasant getting your blood drawn, especially 14 times, it is very important to do these blood tests. You will get many needles and blood tests during your pregnancy. If you get dizzy with needles and blood draws like I do, you can always ask to lie down to get them done. I even had a nurse bring me an ice pack for my neck once. That was really nice. I also like to listen to music, and I never look at the needle. You don't need to do that.
At every appointment, the nurse, doctor, or midwife will take your blood pressure, ask you about your health, and use the fetal Doppler to find your baby's heartbeat. That was always my favorite part of the appointment, was hearing my baby's heartbeat.
At your monthly appointments, you will be asked a series of questions about your health. If you have any symptoms of preeclampsia, including high blood pressure, your midwife or doctor will give you a little strip and a pee cup, and it's to do a urine protein test. So you'll be instructed to pee in the cup, dip the strip. The strip will measure your proteins, and that can help diagnose preeclampsia. Typically, your healthcare provider will order 2 to 3 ultrasounds during your pregnancy. The first one is often called the dating ultrasound and occurs when you are around 10 weeks pregnant. This is to date the pregnancy, see the location of the baby, and to count the number of babies. They should also be able to see the fetus's heartbeat. For this ultrasound, you will have to drink a lot of water beforehand. That's so you can inflate your bladder with liquid, and the ultrasound will be able to see through it more clearly to find the embryo. The second ultrasound, also known as the anatomic ultrasound, occurs in the middle of your pregnancy, usually between 18 and 22 weeks. This ultrasound takes a long time because they are making a lot of measurements, and they're using those measurements to determine if your baby is healthy. So it's important. This is also when some people choose to find out the sex of their baby. So some techs won't tell you because they're scared of liability, but in my experience, most are fine with trying to find the sex, but they might not be able to. In my first pregnancy, my daughter had her legs crossed in every single ultrasound, so we didn't get to find out the gender in the typical ultrasounds. But we did actually pay to get a 3D ultrasound done at a clinic where they will find the sex for you. Those are not covered by OHIP, though. OHIP will not cover any kind of ultrasounds that are not medically essential. While it is not completely necessary, many midwives and doctors will order a third ultrasound near the end of your pregnancy to see the position of the baby, to estimate the weight, and to make sure that baby is still happy and healthy in there.
If the baby is breech, that's when head is pointing up and bum is pointing down. It is much harder to deliver and is not optimal for vaginal delivery. So they may give you some tips and tricks to try to turn the baby, or they can even try to physically turn the baby themselves, or they might plan a cesarean or other delivery options, but it's good to know ahead of time.
The glucose test. So I talked before about gestational diabetes in my healthy eating during pregnancy episode. To refresh, gestational diabetes is a form of diabetes seen in pregnant women who had not experienced diabetes before their pregnancy. It can lead to some serious medical complications and can cause your fetus to grow too big too fast. This can prevent you from delivering vaginally. The glucose test is administered between the 24th and 28th week of your pregnancy. However, your doctor may order the test a little bit earlier if they are seeing any signs of gestational diabetes. The test measures how well your body responds to sugars. So, there are 2 versions of the test. There's the 1-step and the 3-step. So my midwife ordered the 3-step for me because she said that the 1-step isn't as accurate, and if it gives inaccurate or slightly unsure results, they just end up sending you back for the 3-step anyway. So she said it'd be better if I just do the 3-step from the beginning. So I did.
For the 3-step test or the fasting test, you can't eat beforehand, so you stop eating in the evening. Normally, you would sleep all night without eating, wake up in the morning, don't eat anything, and then you'd normally have a morning appointment, so you don't have to go hungry all day. And then you arrive, they'll take 1 vial of blood, give you this horrible orange drink to drink. You have to drink it as fast as you can, and then they'll take your blood again. And then they'll wait another hour and take your blood again. They use these 3 blood draws and see how your body reacted to all the sugar.
For the 1-step or the non-fasting test, you show up, they give you the drink, you drink your drink, and then they take your blood, and that's it. It's not pleasant, but gestational diabetes can cause miscarriage, preterm birth, cesarean birth, and preeclampsia. So it is important to get the test and make sure that you and baby are healthy.
One of the lesser known tests performed during pregnancy is the GBS culture screen. That is a test used to identify whether or not you have group B streptococci. Now, group B streptococci, according to the CDC, is a bacteria that is typically harmless to adults. Many people have it and it comes and goes naturally in the body. However, it is harmful to newborns. So they do this test to identify whether or not you have group B streptococci and whether you will have that during the time of delivery. If you do, don't worry. All it means is that you will have to deliver in a hospital and you will have to have an IV of antibiotics during your delivery.
To test for GBS, you will be given a long cotton swab, a sterile swab. You will be instructed to insert that swab first about 1 inch into your vagina, swirl it around a little, and then you take it out and put that same swab about 1 inch into your anus, take it out, put it in the case, and you give it back to your midwife or your doctor. And then they send it for testing and they'll have the results for you. So this is a test that's performed normally after 35 weeks because they want to make sure the results are accurate for when you give birth. In your last trimester, your midwife or doctor will measure your belly and try to determine the length of your uterus and your baby. This can help identify the baby's size and how close you are to labor. You may also get a stretch and sweep. Typically, these are performed on women who ask for them or who are overdue and the midwife or doctor might offer to do one. Every woman experiences a stretch and sweep differently. I can only speak to my own experience. I had a stretch and sweep done near the end of my pregnancy with both of my girls, and I found it very painful. I don't know if that was just me, because apparently some women don't really find it painful at all. Personally, it was very, very painful for me. So I would say weigh your options, talk to your midwife and your doctor. But a stretch and sweep can help you go into labor, which when you're past 40 weeks is pretty much top of priority for every pregnant woman. So for a stretch and sweep, the doctor or midwife will take a finger and they will insert it into your vagina all the way to the opening of your cervix, where they will try to put their finger inside your cervix and slightly open it and swirl around. So this can bring on labor and it can cause you to lose your mucus plug. But for other women, it doesn't really do anything and it's just uncomfortable. And baby will just come when baby wants to come.
Thank you so much for joining me today. I hope you learned a little bit about what you can expect from your upcoming prenatal appointments. And remember, you can always call, text, email me here, and I would love to answer your questions. Thank you so much for joining me, and I'll see you soon. Bye.